Dr. Matt here from Robina Chiropractic Wellness Centre. Today I'm going to talk about 5 signs why you need to go and see a chiropractor. A lot of the times we just feel like things are just not good, it's cracking, you're stiff, you're sore. Maybe it's a sign. So these 5 things, normally they're warning lights that it's time to go and see a chiropractor. First of all, we're going to talk about the most common one, which is pain. So we got to realize chiropractors don't just treat lower back pain, neck pain, hip pain, referred pain, all of these things. Chiropractors are very, very well trained to actually diagnose these things and work out a proper treatment plan for you. So if you have got some pain, it's not too late to go and see a chiropractor straight away. The next thing is if you're stiff and you feel like you just don't move as well. We've got to just determine then whether it's a joint or it's a muscle or it's both. You got to remember that the whole system is controlled by the nervous system. So muscles don't just work by itself. A lot of the time there will be some sort of nerve dysfunction that'll actually be contributing towards that. Your chiropractor is the best person that actually is going to be able to assess that for you. The third one is you sit or stand too long. Now most of us at work these days, we're seated, except for these of us that actually have a sit-stand desk, which is the ideal. And obviously it will change your posture, your head position, all of these type of things. We do some extensive evaluations of you, even with x-ray, to tell you exactly what that curve of your neck or your back should look like and where you're sitting at the moment, and some interventions of how you can get that curve back to where you need to be. But that is definitely a key. If you sit and stand too long, it's time to go and see a chiropractor. The next one is reoccurring headaches. Now headaches is something, is once again a warning light, a flashing light on that dashboard of your car. Something is going on. Don't ignore it, don't just pop a Panadol, it's time to get that assessed. That could be coming out of your neck, it could be your jaw, it could be hormonal related, it could be sinuses, but let me tell you, Google or ChatGPT won't always give you the answer, and medication is not always your best option for something like that. The last thing that I want to talk about is the people that I'm quite passionate about, is the athletes. Reoccurring injuries. If you constantly struggling with a sore calf and you keep re-injuring your hamstring or your shoulder keep being sore, even after you've done all your rehab, maybe it's time to go and see a chiropractor. Maybe you need to get assessed, see what your nervous system is doing. It might just be that it's coming from somewhere that you don't think, and it's not just a muscle problem or a joint problem, but somewhere else. We're going to look up and below that specific area of concern, and we're going to give you a really good diagnosis of what it is and what you can do about it. I hope that helps. We'll see you next time.